Hey guys, so today I just wanted to talk about something that's a lot of people don't do, the numbers that we need to know, and some things that we need to be working on. If you're not doing this, you need to start doing it. So first of all, every year you need to have your annual physical exam at your doctor's office. Especially if you have insurance, preventative care is free. You don't pay a deductible, you don't pay a copay, and so you should be taking advantage of this. An annual physical exam would be the doctor checking you out from head to toe. Then you get to know your numbers as far as your blood pressure. It's important to know what your numbers are. The normal blood pressure is usually 120/80. And if you're consistently above that, maybe 130s, 140s, you may be pre-hypertensive. And so the doctor may look into putting you on medication, or maybe just changing your diet, exercising more, losing some weight. Because if your blood pressure is consistently high, you can be at risk for a stroke. You also know your height and weight. How much do you weigh? Usually we don't weigh ourselves, so some people go months and months without weighing. It's a good idea to at least once a month, or even more often, weigh yourself in the morning when you get up, just to know what your numbers are. Usually your height and weight will determine your BMI, your body mass index, which is how much fat you have in your body. Also, make sure you're getting your annual eye checkup. If you have insurance, you have vision insurance, you need to have your eyes checked once a year, whether you wear glasses or not. But then how would you know if you need glasses if you don't go for your eye checkup? They also check for so many other things, like pressure in the eyes, if you have any cataracts or any other issues, infections that affect the eye. Don't just wait until you have eye pain to go to the eye doctor. That is also a preventative care, so make sure you're checking that out. If you wear glasses, your prescription strength of your glasses changes sometimes year to year. Don't use one pair of glasses for years and years and years. You need to go get checked to make sure that you're getting the right prescription for your eyes. Another thing that people don't do, they do have, let's say you have dental insurance, you need to have your teeth cleaned twice a year. That's part of your insurance, and that's part of your preventative care. Twice a year you need to go have your teeth cleaned. It doesn't take long, maybe 30 minutes. Have a regular dentist that you see, so then they can have your records, like your x-rays and such, things like that. You should also have your annual labs. Some people have it more often, but you need to know your numbers as far as your labs are concerned. You need to know what your H&H is, which is your hemoglobin and hematocrit. It determines if you're anemic or not. Some people are always tired. You could be anemic because we're not getting enough iron from the foods that we eat, and so the doctor may decide to either put you on some iron medication, or you may have to change your diet to be able to get more iron in you. The hemoglobin in your blood carries oxygen all over your body, so if it is low, you're gonna always be tired. You're not gonna be at par. This happens a lot, especially in women that are still going through menses. Sometimes your hemoglobin is low. Adolescents, young adults, just make sure that everybody, even men, that you're checking your numbers as far as your H&H hemoglobin is concerned. Another lab that you need to be aware is your blood sugar. What is your blood sugar level? That can also be part of your annual checkup. Some people have them done more often than others, but your blood sugar should be 100, 70 to 100 is where we want it to be, especially fasting. If it's consistently higher than that, you may be pre-diabetic, so then you need to see your doctor. It's important to see your doctor and get those things done. Some of the labs that they'll also do is your cholesterol level. Your cholesterol level is important to know because cholesterol will plug your arteries, and it will make your blood not be able to pump effectively throughout your body. It will make your heart work harder. So make sure you know what your cholesterol numbers are. There's good cholesterol, there's bad cholesterol. It also just is dependent on genes plus what we eat. So if you don't know your numbers, you will not know to take care of that. You also want to know your kidney function, your BUN and creatinine. That can be ordered as part of your basal metabolic panel, or maybe a comprehensive one, to be able to know if your kidneys are functioning correctly. You also want to know your A1C. Your A1C is just a number for blood sugar. It determines what your blood sugar has been in the last 2 to 3 months. As a nurse, we get patients that are diabetic at the hospital, and they tell us, oh yeah, my sugars have been good, I've been good. And then when we check their A1C, it's through the roof. That means that their blood sugar hasn't been good in the last 3 months. So just make sure what your A1C is. If you're not diabetic, you need to at least have that done once a year. You also need to know what your vitamin D levels are. Vitamin D is important in the muscles and also in your brain cells. It helps with your vitamin D with calcium, helps with your bone health. So it's important to know what your levels are. When your levels are low, you're always going to be tired. It's also important to know your TSH level, which is your thyroid. Thyroid does so much stuff in your body. Sometimes some people have all these kind of symptoms, their thyroid levels are out of whack. Make sure that that is part of the labs that you get done. As well as, if you're in your 40s, you need to make sure that you get a colonoscopy. If you have a history of a colon cancer in your family, you need to have that earlier than later. Colonoscopy just determines if there's any polyps or any they can take biopsies to look through your colon to see if there's anything wrong there. I work in a GI lab. We do colonoscopies, and believe me, they take like 15 minutes and you don't even remember. People are so afraid of getting a colonoscopy. It's very safe. It doesn't take long. As well as an endoscopy, which is they go inside, they go through your mouth to check, like if you're having any issues with abdominal pain, or you're having any bleeding, or you have reflux, you're always having heartburn, talk to your doctor, so maybe they can send you to a specialist to go see. They put a camera in there. It's like a tube. They put a camera in there to just check your gut to see how it is. And then the colonoscopy is through the other end, where they go in and check your colon to make sure that everything is okay. If usually you get a colonoscopy and it's good, they just tell you, what, you don't have to come back for another, 10 years, and maybe unless you have symptoms, that you have blood in your stool or things like that. You should also, for men, you should always know what your testosterone levels are, as well as they need to do a PSA test, which is the prostate specific antigen, to determine if there's any prostate cancer. I know that my father-in-law had prostate cancer, so my husband has been checking his PSA levels. It's a blood test, so it's not anything where someone has to go somewhere and touch stuff on you. They draw blood, they check to see if it's high, and even if it's high, it may not be cancer, but it may be something concerning that the doctor can take care of. For women, make sure you get your mammogram every year. Once a year you go and you get your mammogram. If you have a history of cancer, breast cancer in your family, you have to get that. You have to have other testing done. You have to talk to your doctor about that. As well as women, you need to have a pap smear done once a year to check for cervical cancer. Make sure you're doing your self breast exams once a month in the shower. There's so many resources online that you can look. If you just Google a breast exam, you'll be able to see. So you're able to tell if there's any changes in the consistencies of your breast mass, and see if there's any issues there that concerning that you need to talk to your doctor about. There's so many things that we don't do, either because we're just busy, or we just think, there's nothing wrong with me, so I'm not gonna bother. But it's important to know your numbers and to be consistent in doing your testing, just to be ahead of the game. Some things, when they're caught early, right away they take care of them. Sometimes we wait until it's too late, and then it's hard to be able to treat, and you're having a hard time, and your family is being affected. I would like for you guys to follow and subscribe so you can get more information. Thank you.